Muscular Dystrophy by Hannah Weissel, University of Kentucky. Muscular dystrophy is a group of genetic diseases that affects the voluntary muscles of the body. These muscles are also known as skeletal muscles. The skeletal muscles control our main movements of our body, such as walking and talking. Muscular dystrophy affects these muscles by either weakening them or deteriorating the muscles in our body. There are 9 types of muscular dystrophy. They are Duchenne, Becker's, limb-girdle, congenital, facioscapular, myotonic, oculofaryngeal, distal, and emerging Dystrophy. Due to the lack of a protein called dystrophin, muscular dystrophy is formed. The muscles in our bodies are made of bundles of individual muscle fibers. Each muscle fiber has an outer membrane that is held up by a protein called dystrophin. When that protein is absent, caused by muscular dystrophy, creatine kinase then leaks out of these muscle fibers, muscle membranes. The leaking of creatine kinase or the absence of dystrophin can also be caused from defective genes. Having the absence of dystrophin and the leaking of creatine kinase causes the muscular dystrophy. Duchenne muscular dystrophy is the most common muscular dystrophy. The symptoms of this dystrophy usually do not seem to appear until 3 to 7 years of age. This Duchenne muscular dystrophy weakens the muscles from the lower part of the body and rapidly moves to the upper part of the body. Duchenne muscular dystrophy is more prevalent in boys than it is in girls. Due to the weakening of the lower part of the body first, walking is very difficult and wheelchair is usually needed by the age of 12. People diagnosed with Duchenne muscular dystrophy tend not to live past their teens or early 20s. Becker's muscular dystrophy is very similar to Duchenne muscular dystrophy, except for the weakening of the muscles is in a slow manner. The symptoms tend to not show until later in a person's life, around their 20s or 30s. The muscle weakness moves from their lower body to their upper body, but in a slow manner. Those diagnosed with Becker's muscular dystrophy tend to live to their 40s or 50s. They also tend to have breathing problems as well. Myotonic muscular dystrophy has symptoms show later in the adult years. Myotonic muscular dystrophy is the most common adult form of muscular dystrophy. It is characterized by more muscle spasms, cataracts, and occasionally cardiovascular problems. It causes the patients to have thin faces, drooping eyelids, and a long neck. The progression of the muscle weakness progresses slowly. Facioscapular muscle dystrophy affects the muscles of the face, shoulders, and upper arms. The symptoms tend not to show until between the ages of 10 and 40 years of age. It affects both men and women equally. It is also known as FSHD, and the progression of the muscle weakness and deterioration is slow. There are 2 forms of getting a sure diagnosis of having muscular dystrophy. The first way is through a blood test. The blood test looks for an increase in creatine kinase or notice the absence of dystrophin. The second way to diagnose is through a muscle biopsy. A muscle biopsy is when a small sample of a muscle, usually from your leg, is looked at under a microscope. Other possible ways are observing muscle weakness and genetic testing in the child's young age. In the United States, muscular dystrophy affects 63 people out of 1 million. Worldwide, it affects about 5 to 10 people out of 100,000 people. It affects all races, ethnic groups, and social classes, but most forms of muscular dystrophy are seen to be more prevalent in males than in females. Unfortunately, there is no cure to muscular dystrophy. However, there are methods that help to prevent or help the patient diagnosed with muscular dystrophy. Some of these ways are physical therapy, occupational therapy, speech therapy, assistive devices, and surgery. All forms of muscular dystrophy are said that regular stretching is a way to help all forms. All three of these websites are resources that families dealing with muscular dystrophy can use. MDA, or Jerry's Kids, provides services and chat rooms for families that are dealing with muscular dystrophy. Muscular Dystrophy Family Foundation also provides services and gives an opportunity for families to participate in events to benefit the research of muscular dystrophy. Muscular Dystrophy Family Village gives families links to chat rooms to talk with other families that are also dealing with muscular dystrophy. All three of these sites also provide valuable information about muscular dystrophy and all of this following information. These are a list of the resources that were used to make this presentation and information. Thank you very much for your time, and I hope you enjoyed.